main questions that we are looking at in sports medicine. So firstly, how are sports injuries classified and managed? Secondly, how does sports medicine address the demands of specific athletes? We then look at what role do preventative actions play in enhancing the well-being of the athlete, and how is injury rehabilitation managed? What I've also done is I will be going through today the first two. So just these two today. So we'll be going through that and looking at all the dot points with these. With these two, I'll be talking you through them, just because these are more so it's not the theoretical as such. Like with the first two, you'll notice, especially here, there's a lot more theoretical knowledge that's evident. With these two, you know, it's knowing examples, and it's a bit more, and it's some of this is repeated in like factors affecting performance. For example, with preventative actions, we look at warm up versus cool down. So we've already talked about it. So I'll talk you through the dot points here, but I'm going to focus more so on the first two and, you know, really work through those two. Okay, so this is firstly we've got how are sports injuries classified and managed. So for this, we want to focus on the ways to classify sports injuries, the different types of soft tissue injuries, hard tissue injuries, and assessment of injuries, how do we assess them. Then what your job is to firstly, for example, identify specific examples of injuries that reflect each of the classifications. So you should be able to give me an example after we go through the content, and I'll give you examples too, of what is a direct hard tissue injury, or what is a soft indirect tissue injury. Then with the soft tissue injuries, you need to be able to tell me how we manage them. I talk specifically about RISA. So you should have already looked at RISA in year 11, and so we'll, you know, add on to that. And also give me the immediate treatment of the different types of skin injuries, which I'll go through too. We're then looking at the hard tissue injuries. So we're looking at fractures and dislocations. So you should be able to tell me how we manage hard tissue injuries, the assessment for medical attention, and also immobilization. So why do we have to immobilize hard tissue injuries? Then we'll talk through the assessment of injury, so toe taps, talk, observe, touch, active and passive movement, and skill test. And you should be able to tell me what each one is and really talk me through each one. This could easily be like a 5-6 marker. We have to explain each one and actually give me examples on how you would go about doing each step. And we're going to go through this today. So let us have a look. Firstly, if you've got indirect and direct injury, injury is classified as direct if there is an external force which is impacting on a person. So for example, if we have two players colliding in a soccer tackle, and that causes an injury, A direct injury can also be caused by any external object. So for example, if you are hit by a ball, that could be an external injury. So that is a direct injury. So it's coming from an external force. An indirect injury is when there is an internal force within the body. So more than likely, usually it's a wrong technique that or you know, poor technique or even equipment. So that is when it is from within the body. So an example could be you pull a hamstring while you're kicking a penalty. In soccer, from overextension and a lack of warm-up. So that's indirect because it's an internal force. So soft and hard tissue injury. So soft tissue injury has to do with the body tissues, and it generally results in internal bleeding or bruising. So soft tissue injuries can impact muscles, tendons, ligaments, and skin, and there are like specific classifications for each. So muscles, if you have a soft tissue injury on muscles, you have what we call if you have a soft tissue injury on muscles, you have what we call strains. However, if you have a soft tissue injury on tendons, that is a strain. So injury to muscles is called strain. Injury to tendons, Okay, sorry, I confused myself there for a second because I thought I may have done a typo, but no, both are strains. So muscle and tendon injuries are strains. However, injuries to the ligaments are called sprains, and then skin injuries can be classified as abrasions, lacerations, contusions, and blisters. So remember, the tendons connect muscles to bones. That's why injuries to muscles or tendons are both strains, while ligaments connect bone to bone, and they're called sprains. A good way to remember that, I just came up with like very randomly, is bone to bone is ligaments. I just like to remember it as BBL. Being like a cricket fan, like it just sticks with me. BBL is bone to bone. And that obviously refers to the Big Bash League. Like that's the reference here. If you didn't get it, if you're not a sports, if you're not a cricket person, but that's one way I remember it. But feel free to come up with any, acronym or any acronym that works for you. So we also have so we've got hard tissue injuries, which are injuries to bone and teeth, and they can be either dislocations or fractures. Overuse injuries can also happen, and they occur as a result of repeated force being exerted on body parts, including bones, tendons, and muscles. And we'll talk a bit about this when we look at catering to the different types of athletes. But for now, you just need to know that this is when we are putting repeated stress on like bones, muscles, tendons, or a specific body part in general. And examples include shin splits, stress fractures, and tendinitis. They're always indirect injuries because it's internal force, wrong technique, for example, in tennis, or it can also, or while you're running, like, or for example, like if you're running and every time you may be running differently, or you may be like putting more force on one foot than another, which is it could be subconscious. That's an example of indirect injury. Okay, moving on. So next we've got classifying each one. So we've got tears, so tissue fibers of ligaments, tendons, or muscles are torn. So let me get my pen up again. Okay, so we've got tears, so tissue fibers of ligaments, tendons, or muscle are torn. Remember, so either of three, that's a T, and the cause can be a sharp movement or tight muscle. So that's, for example, if you've got like if you pull hamstring, that is because it could be sharp movement, not enough warm up, and that results in like tight muscle. Then sprains refer specifically to injuries that are related to the ligaments, when ligaments are forced beyond normal range. So the cause can be incorrect landing, uneven surface. Strains refer to injuries that are to the muscle or tendons, where tendons connect muscle to bone, ligaments connect bone to bone, and cause again can be incorrect landing, uneven surface. Contusions are blood tissue and cells being damaged, which causes internal bleeding. So you want to know what each one is. Generally, contusions occur due to collision with a person or object. Skin abrasion refers to minor open skin wounds. So that can be a result of falling over, scraping skin, and the management now is cleaning with saline solution, water, and apply bandage. Finally, we've got blisters, so that could be due to frictional rubbing and pressure on the skin. Cause can be poorly fitted footwear or equipment, so generally this one has a lot more to do with equipment, but also overtraining. And management is pierce express fluid, cover with sterile non-adhesive, so you basically open the blister, and apply padding and tape. So these are the different types, and you want to know the management for these. With these sprains, tears, and soft tissue injuries, those would require RISA. So don't forget RISA, rest, ice, compress, elevate, and refer. So that's that. I'll quickly go through toe taps as well. So toe taps refers to talk, observe, touch, active movement, passive movement, and skills test. So if someone's got like, for example, if they've got an injury, especially a hard tissue injury, what we do is we So if they've got an injury, we would firstly talk to them, ask them what happened, how it happened, what do they feel like, and this is obviously if a person's conscious. If they're not conscious, you're looking at like doctors A, B, C, D. But yeah, so with this, we're talking to them, how they're feeling, we're observing. For example, are they like flinching? Are they like are they looking pretty relaxed, or do they look like they're in obvious pain? We would then touch. Now when it comes to touch, you need to ask the person, like, you've your ankle looks a bit swollen, can I touch it, can I feel it to see if it's like hot, and how swollen it is, for example. So that's touch. And in observe, you will also look at, for example, if you've hurt like your right ankle, if the athlete has hurt their right ankle, you will compare that to their left ankle and observe to see if there's any like apparent difference there. Then we've got active and passive movement. So active movement is when we would ask them to move, for example, to try and move their foot. If they're able to do that, that's good. If they're not able to do that, we would do passive movement, and that's where you're asking them to can I lift your foot up, can I actually move your foot around? And that is something, again, you have to be very careful when you ask them, and they have to say yes. And you would see, for example, if it's their right ankle, if you're moving it to the left, are they like really flinching, or it's not hurting as much? What is the sort of how much can they move, right? And finally, a skills test. Now a skills test is if they're feeling pretty okay, they're still able to move, like they've passed the active test, and so when you get to the skills test, if it's a soccer player who's hurt their ankle, the skill that you want them to test is being able to run. You'll ask them, okay, go ahead, run. And if they're able to run, if they're looking okay and it's not hurting them too much, then they can continue on with the play. But if they've already failed the active and passive movement, and they obviously, then you wouldn't proceed to the skills test. So this is where you can get questions like, a player, this has happened to a player, what would you do? Those are the sort of the simulated scenarios that you need to then apply this understanding to. Okay, wonderful. So that brings us to the end of how a sports injury is classified and managed. Now we're looking at a big second dot point of how does sports medicine address the demands of specific athletes. So with this, we are going to focus on 3 types of athletes. So we learn about children and young athletes, we learn about adults and aged athletes, and female athletes. So with each one, for each one, for example, for children, you need to be able to analyze the implications of each of these considerations and how it's going to affect young people participating and engaging in sports. With adults and age athletes, you want to explain the sports participation options that they have, especially for aged people that have medical conditions. What can they participate in? How should they participate? Then you've got female athletes to assess the degree to which iron deficiency and bone density affect their participation in sports. So for each one it's different, but it's about applying all of what we talk about here. So we'll look through all 3, and again, your job is to look at and apply that knowledge. So let's start with children and young athletes. So firstly, asthma. I'm going to sort of give you the theory for it because it's important for you to know, if you get a question about if a young athlete has asthma, how should a coach manage it? Questions like that, you need to be able to actually give me information about what the condition is, what it involves, and how the coach is to manage that in the athlete. So with asthma, it is characterized by the inflammation of the airways when irritation occurs, which means that there's limiting airflow, and it is also triggered by pollen, dust, and even exercise. So high intensity exercise can trigger it. Exercises that are done in longer duration are likely to trigger an attack, and that is why an athlete needs to have asthma management plan. So if you got a question like describe how how a coach should manage an athlete with asthma, it's a 3-marker. You will give me what the condition is, right? You'll explain it. You will tell me that it needs to be managed by an asthma management plan. The athlete should have like a a puffer on them that they're able to use, and the coach should know what to do. That will help you, get 2 marks. And then I'll give you a 3rd mark if you give me an example, which is basically putting this in a scenario. So examples, again, are very, very important for PDHPE. Then we've got diabetes. So there are 2 types of diabetes. We've got type 1, which is a lifestyle disease. So it's a lifestyle, diet, and disease caused by a lack of physical activity generally. So it causes insulin to become inefficient. So insulin is used in the body to control and regulate the level of glucose. So glucose, your body gets glucose after you eat a meal, right? And that glucose is in the bloodstream. And when those glucose levels go high, the body after a meal, for example, glucose levels are high, the body will activate the insulin certain, for example, the alpha, there's a science behind it. You don't need to know that, but it's like a specific type of cells in your pancreas that are then going to start secreting insulin throughout your body, and that insulin is going to deal with the glucose. And what happens is glucose is stored in your kidneys as glycogen. That is how it works. And so if you've got insulin that is inefficient, that means that there's going to build up of glucose in your body, and that is not good. Type 1 diabetes, on the other hand, is an autoimmune response, and that is because the immune system doesn't recognize the body's immune cells, and so that is characterized by the body's inability to produce sufficient insulin in order to control and regulate the glucose levels in the body. So in either of the case, the coach obviously needs to know what is happening, but what is happening, firstly they need to make sure that generally with something like this, you've got 2 types of episodes. You've either got a hypoglycemic episode or a hyperglycemic episode. So obviously the coach needs to be mindful of this. And with a hyperglycemic episode, what happens is they have a sudden onset and cause of it has a sudden onset, it just happens, and it can include the symptoms include the signs include rapid heart rate, sweating, shaking, anxiety, dizziness, and unconsciousness. And this is managed by providing them with sugary foods or drinks such as jelly beans and juice, and further food needs to be consumed afterwards. So this is when we see that their blood glucose levels have gone really low, so that is why they need to consume sugary drinks and food. So the coach, for example, needs to recognize those signs. If you get a question like this, a young athlete has diabetes, and they don't sort of specify which one it is, but it says a young athlete has diabetes, how should a coach manage that? You should be able to tell me that the young athlete, if they have either type 1 or type 2 diabetes, both of which affect the ability of insulin to control and regulate glucose levels, and that can result in hypoglycemic and hyperglycemic episodes. Hyperglycemic includes these specific signs because the blood glucose level has dropped down, and that means that the coach should be aware of this and immediately feed the athlete with high energy foods like jelly beans or juice. On the other hand, hyperglycemic episodes occur slowly, and they may cause thirst, vomiting, weak rapid pulse, rapid breathing, and drowsiness, and medical assistance should be sought in treatment of hypoglycemic episodes. So this is when your blood glucose level has spiked high. So when that happens, obviously you're not going to go feed them high energy foods because the blood glucose is spiked high. So this is where you need to take them immediately to get medical assistance. So that's diabetes. And finally, we've got epilepsy. So epilepsy is a condition which is characterized by disturbances to the brain, and that can cause episodes of unconsciousness. And also, if someone's got epilepsy, their physical activity should be monitored, and they should not participate in specific sports, for example rock climbing or diving, and they should Sorry, I've sneezed. I feel like it's coming, but it's not. Excuse me. But yeah, so physical activity should be supervised. Like, you know, they should not do sports like rock climbing or diving with that like high altitude, or like, you know, they're underwater where, you know, it would be hard to actually tell what's happening. Like, just to identify if they're having a seizure or not. So that is very important. And also they should also exercise along with someone else, so there should be someone supervising them. So as a coach, you know, you should always be keeping an eye on them and making sure that they are participating safely in a safe sport. And that is, you know, a parent's job, really. Okay, now we've got adults and aged athletes. So the three conditions that we want to talk about for adults and aged athletes, firstly, is heart conditions. Now, as one ages, your susceptibility to heart conditions increases, and this is generally related to like hypertension, a sedentary lifestyle, and like general lifestyle behaviors, and also cardiovascular disease. So yeah, and all of these are like really linked. So, you know, if you've got higher blood pressure, your susceptibility to cardiovascular diseases increases. Same thing with like high cholesterol levels, and that will, you know, increase susceptibility to heart conditions. Aged athletes, when they're participating in sports, they should check with their GP first and get an all clear before starting, and they need to stop at any signs of discomfort, and also work out with like family and friends, and that is generally suggested, so that they, you know, if something does happen while they're working out, they're not alone. There's someone to sort of support them and get the help that they need. So the big thing for aged athletes is to get like a clearance of their GPs first. Now, looking at fractures and bone density, so after the ages of 35 to 40, what happens is that your bone density begins to decline, and your bone becomes more fragile. So elderly people are more likely and more susceptible to weaker bones, and thus fractures. If they fall down, they're more likely to get a fracture. And further, osteoporosis is also common with low bone density, and it can result in you know, low physical activity. So that is why strength training, like resistance training for elderly people, can be important, because generally, you know, because our bones grow in like as a result to and in the direction of like pressure and weight. So if you are not exercising, if you've got lack of physical activity, you're not, you know, it can really lead to more bone reabsorption than bone modeling, and then bone remodeling, and as a result you get weaker bones because more calcium is being taken away from your bones. So strength training can improve bone mineral density and also bone strength. So finally, having a look at flexibility and joint mobility. So as an aged athlete becomes more sedentary, their range of movement also is limited. You know, the thing with body is like, if you don't use it, you lose it. So you need to use your body in order to ensure that it's still functioning and it's, you know, still healthy. So if you have a sedentary lifestyle, your range of movements is, as a aged athlete, your range of movements become limited, and decreased flexibility again can lead to more injury of muscles and ligaments, and also of course less mobility, and there is more risk of, you know, like we said earlier, falling and injuries. If an aged athlete does not continue to move, heart condition, loss of strength, and lack of flexibility will arise. So heart condition, if they have a sedentary lifestyle, heart condition, they're susceptible to that. Loss of strength because of decreasing bone density and osteoporosis, and also lack of flexibility. Okay, now let's have a look at female athletes. So when we are looking at female athletes, we want to consider the triad. And within the triad, we're looking at three main elements that affect you know, female athletes and underpin the aspects that we need to sort of, you know, be very mindful about when it comes to their safe participation in sports. So there's eating disorders, menstruation, and weak bones. Those are the main three things. So let's have a look at how that directly affects sports and the performance in sports. So we've got bone density. which firstly is largely affected by low levels of estrogen in menstruation irregularities. Diet, like low calcium, which means that their strength and muscle, which will affect their strength and muscle and also their nerve function. Menopause, so women lose calcium faster than men, therefore that can lead to brittle bones and thus need to ensure safety when they're exercising. And the reason that this happens as a result of menopause is because of estrogen plays a huge role in bone remodeling. In bone remodeling. When women go through menopause, their estrogen levels like drop really rapidly. So there's a rapid decline in the level of estrogen levels, which means there's a rapid decline in bone remodeling, and there's more bone resorption that's happening. So more bone reabsorption versus remodeling means that they are losing the bone faster, and calcium is being taken away from the bone faster. So it's breaking down faster, but it's not being rebuilt. And so as a result of that, they're more susceptible to brittle bones. And there's another factor that can affect bone density is amenorrhea. So that is when they have that is absence of periods, which again means that they have low estrogen levels, and that again affects bone remodeling. Finally, estrogen, like we said, plays a huge role in strong bones. So so when women hit menopause, the estrogen levels drop significantly, and that means that their bone reabsorption is happening faster than bone remodeling, so their bone strength declines rapidly as well. Iron deficiency is, firstly, iron itself has a huge role to play in the transportation of oxygen, so it helps hemoglobin bind to oxygen for transport. And low iron means fatigue, lethargy, and weakness. And women are more prone to iron deficiency because they lose blood and iron through menstruation. So that's why they have to consume extra, generally take like iron supplements. Iron deficiency can also come about due to insufficient consumption in diets, especially if you're vegetarian, vegan, or eating or if they have eating disorders that can lead to high rates of iron deficiency. So eating disorders, females are more susceptible to eating disorders, especially like due to the sports that they participate in. For example, gymnastics. Like there's a huge focus on the appearance of the body, and that can have a huge impact on obviously a female athlete's psychology. And bulimia and anorexia nervosa are the disorders that can result as a result of this pressure. So if an eating disorder manifests itself into extreme weight loss, females can lose their menstruation cycle. This is why it's harmful, because if they've got extreme weight loss, that can affect their menstruation cycle, which will in turn affect their estrogen levels, which will affect their bone density, right? So that means that they have poor skeletal health, and again more risk of injuries as a result of like bone fractures. Pregnancy, so they're more susceptible to injury during pregnancy because of a hormone called relaxin, which loosens joints and increases joint mobility, making it easier to become injured. Increase in weight can also be a risk of injury due to increased impact. And exercise is most definitely recommended to reduce the risk of gestational diabetes, help mood, and help maintain the before weight. And allows them to get back sooner into performance after pregnancy. So that's done. Alright, so we've talked through these 2 points, and I'm just going to talk through what the main ideas are for the next two. So what role do preventative actions play in enhancing the well-being of the athlete? Like I said earlier, with the first 2 topics, it was more theory related, like you had to know, for example, the different diseases, what was happening more biologically. With these 2, it's more about like sports rules and stuff. So with physical prep, like so basically preventative actions, we want that athlete to be physically prepared. So pre-screening, getting a medical clearance of their doctor, which we've talked about in adults and aged athletes. Their skill and technique needs to be on point. Physical fitness needs to be up, and they should be warming up, stretching and cooling down. They should be warming up so that they have increased muscle flexibility and cooling down so that they can disperse like lactic acid and stuff and not have, DOMS, like delayed onset muscle soreness. Sports policy and sports environment, so you'll talk about, the rules of sports and activities, how there are rules to keep the players and the spectators safe. There are modified rules for children like kangaroo cricket, and like examples of those where, you're reducing the time, you're giving everyone a fair play. For example, in kangaroo cricket, every child gets 2 overs, and also a chance to bat, and that way, a child is more all-rounded, and so they won't get like overuse injuries if you've got like one kid who's the star bowler bowling all the time. Matching of opponents, so this is something that you'll discuss in terms of, in all events should be organized in ways so that opponents are evenly matched up. If you've got like physical differences there, like huge physical differences, we can see how one player may be more may benefit more in comparison to the other player. We also look at the use of protective equipment, so there are more chances of injuries if if the equipment is not fitted, if it's not perfect. So you can get so you can so that can increase your chance of injury, hence you need protective equipment. Safe grounds and facilities are also important to keep spectators and also the players safe. So for example, having like making sure there's no rubbish on the fields, that spectators are kept at a distance, like there are proper arrangements there. Environmental considerations, so you'll talk about like temperature regulation, climatic conditions, how a player would adapt to different types of conditions, like in like high temperatures, how would we for example, how would a player adapt to that. Wind, rain, altitude, guidelines for fluid intake, so that is very similar to what we looked at in sport in factors affecting performance when we talked about hydration, guidelines for fluid intake, and acclimatization. Finally, taping and bandaging. So this is where we're looking at what the role of preventative taping is, and taping for isolation of injury, and also bandaging for immediate treatment of injury. Then, how is injury rehabilitation managed? So for this, you'll look at the rehabilitation procedures, so progressive mobilization, graduated exercise like stretching, conditioning, total body fitness, training, and also the use of heat and cold. So the use of heat and cold is very similar to cryotherapy that we looked at in factors affecting performance. Similarly, the last bit about returning to play is all about making sure an athlete, after they have if they've been injured, they can return, like they when they return to play, they are pain free. There's a degree of mobility. We monitor their progress, so pre-test versus a post-test, to see if they've recovered. We also look at psychological readiness, if they're psychologically ready to come back. Some players may be too ready, so they may be ready to come before they're physically healed. We look at specific warm-up procedures, so very similar to factors affecting performance, and also ethical considerations. So here you look specifically at the use of painkillers and how a lot of athletes had been consuming painkillers to come back earlier, but that in the long term injured them and affected their overall well-being. Okay, so that's that done there. Again, if you have any questions, please put them through. I know I would have loved to go through, the last in more detail, but obviously time constrained. Obviously we're constrained by time, and I felt like the first two had more theoretical knowledge that you needed to keep in mind in comparison to the last two. That's why I chose to go through those two. Okay, now let's have a look at what the essential ingredients for success are in HSC PDHPE. So, really important, firstly, understanding the question. You need to know the syllabus terms and the surrounding dot point. Like I said, you can be asked about, for example, rehabilitation procedures. How can an athlete rehabilitate? What should they do? So you need to know the 4 dot points underneath. You need to be able to talk about progressive mobilization, graduated exercise, training, use of heat and cold, all 4 to get your full marks, because that is what makes up that dot point. So understanding